My name's John Bulger. I'm a physician. I'm the Chief Medical Officer for the Geisinger Health Plan.
My name is Daniel Durand. I'm the Chief Innovation Officer for LifeBridge Health.
So health tech can play a big role in helping providers deliver care, and in the end, help providers with their satisfaction with their daily work and lives, and actually, I think in the long run, decrease the amount of burnout with providers.
I think there are a variety of ways that health technology can help alleviate burnout.
It does that by, one, using the data aspect, so you're getting information to the provider just at the right time in their workflow that actually helps them take better care of patients.
So I'll give you some examples. So the traditional office workflow where physicians have to think about urgent access, where they may have patients coming in for sick visits that disrupt the flow of their day, or other types of requests that could be automated. Health tech could clearly help deal with some of that.
Two, you can extend the provider's reach by using things like telemedicine or other tech modalities which allow the provider to do more things.
Things like virtual visits for patients with urgent issues. If there's a business model as well as a technological model that can get that done for a physician, then I don't know any physicians that wouldn't want those urgent visits taken out of the middle of their day so they can focus on the more complex patients and operate at the top of their license, right? So
and then three, you can make the provider's job easier by, instead of them having to do things they used to have to do manually, the tech can help them do those things in a more efficient way.
So I think it's technology plus. It's plus payment mechanisms and business models that make sense. It's technology plus the right people and the right interoperability to make it so that when you add a new capability and a new way a patient can experience care, that it doesn't wind up being an interoperability nightmare, right? That it doesn't wind up being kludgy, but that it's seamless. So
the big key, though, is when you're doing all that, is that this is not an add-on, and it actually works within the provider's flow, and you have providers that are part of coming up with what that flow is going to be, as opposed to something that's forced upon the provider and says, well, here's this thing that's going to help you, and it turns out it doesn't because it creates more work for them in the long run.
So in those ways, and in ways having to do with documentation and automation of note creation, automation of the way that orders are generated. So if a physician sees a patient and the EHR prompts him for 5 or 6 orders, which are 99% of the time appropriate for that patient, well, obviously that's an order system. Like, what's not to love about that? You don't have to take out a piece of paper and write the stuff. The computer's presenting you with ideas, and as long as they're largely correct, then that kind of automated decision support would be very welcome. The issue is the instances of that being done perfectly these days are few and far between. And I think we're just at this moment where we're learning to get it right. But I believe that we will get it right.